My name is Samantha Butts. I am the Division Chief of Infertility and Reproductive Endocrinology at Penn State Hershey Medical Center. And I have been in that role for a little bit over 5 years.
Nice. Can you tell me a little bit about what initially drew you to REI?
My desire to do OBGYN has a definitive origin story and is highly personal. So I'm a triplet. And my mother delivered a set of triplets, spontaneous triplets, by the way, and carried a set of triplets full term. But as she was getting further along in her pregnancy, blood pressure started to go up and up. And she delivered. And the fact that my mother left that hospital alive. I was delivered at Beth Israel Hospital in New York City, left the hospital alive, has everything to do with the outstanding medical care she received and also the advocacy of my dad to look out for her best interests, really is the best way to put it. She developed severe preeclampsia. Her preeclampsia did something paradoxical. It didn't get better after delivery, it got worse. She went into acute renal failure. She was in the intensive care unit, central monitoring. And my father was witnessing my mother's deterioration and was in active dialogue with the medical team about all of this as a loving husband, but also as somebody who didn't want his kids going home without a mother. And I think about that story a lot. I've always thought about it. My mom used to share the story when we were younger, and it never really resonated with me. It did, but resonated with me differently when I went to medical school and especially after I did my OBGYN clerkship at Brigham and Women's Hospital, where I really understood what was happening and what could have happened. And this, the whole incredible relationship, the mother child dyad, I guess in our situation, it was a not a dyad, it was a quad ad, or it was three kids and a mother, but you know what I mean. That it is such an incredible phenomenon, and that it can also be an incredibly tenuous set of circumstances for everyone involved. And it does really take outstanding medical care. It takes respect of patients. It takes advocacy, all these things. And I just am so incredibly thankful that all of that came to bear and also I realize I am incredibly fortunate because we're dealing with a maternal health crisis in this country, often particularly affecting Black women and women of color. And I absolutely realize my good fortune in that moment. And I think it touched me in a way that made me want to be part of those experiences, those relationships with patients at the most joyous times, but some of those most joyous times can turn into the most dire times as well. That's what drew me to women's health. And then for reproductive endocrinology and infertility, it was this gradual draw as well. And I think REI taps into my inner hormone nerd, for lack of a better way of putting it, like pathways. And there's something about understanding and assessing those pathways and getting some clarity for patients. I feel like I see a variety of patients across the lifespan, right? I see adolescents and young adults. I see women who are postmenopausal. I see everything, all ages in between. I see individuals and couples. And I like that, the ability to have that variety. And I like the challenge that it brings.
That's amazing.
Thank you.
Talk to me a little bit about a mentor that you've had or a mentoring experience, maybe from the other side, that you've participated in that was really meaningful to you.
I feel like I've also been incredibly fortunate to have a variety of mentors. One of the lessons that I learned probably from my parents very early on is having multiple mentors is always an incredible gift
Yeah.
because every mentor has their own strength, whether it's your research mentor who's going to help guide you in that aspect of your career, whether it's a somebody who is more of a life coach and helping you think through how you perhaps balance your personal and professional goals. All of these people are so valuable. When trainees and students ask me, what makes a good mentor mentee relationship? I often say that your mentors want nothing more from you than the pride of knowing that you're doing well or the ability to support you when there's a struggle. If we don't hear from you, we can't be a part of the celebrations, nor can we be a part of the solutions. And I think if I've had any success in in the relationships I've had with mentors is staying in touch
Mm.
and letting them know what's going on in my life.
Tell me one thing that you would like somebody who's considering a career in REI to know, to a skill they should acquire that may not be a usual skill, something a little bit out of the box.
I think there's a lot of things people have often called these soft skills. I choose to see these as superpowers. Maybe it's passe, but intellectual curiosity and growth mindset. And I say that especially as we are coming off of five of the most difficult years in modern history, right? Where it's been very difficult to have to talk about bold thinking and a growth mindset when the world was a very different place just 5 years ago. And those are, I think, skills. It's not, I think those are incredibly important skills. I'd also say if you have a growth mindset, it's not such a stretch to think about how do I build relationships and networks. We just finished talking about mentorship, and there's so much in medicine and in life success generally that has to do with the types of relationships that you make because the best relationships, in my experience, are based on trust. And if people trust you, they can envision working with you. They can envision collaborating with you. They can envision giving you a job. All of those things are so highly valuable. There are a lot of people to whom these skills come naturally, but I think that they can be cultivated in many other people and it has to be modeled, right? It has to be, you've got to see the behavior model, then you have to see the reward for having those traits and behaviors.
That is great advice, to find someone who models the behavior that you really want to cultivate. So, I did want to talk about how the field has changed in the last 5 years. You just talked about how the world is a very different place than it was just 5 years ago. Can you talk about one big shift that you've seen in reproductive medicine in the recent time or during your career?
Certainly, you asked before, what was it about reproductive medicine that was a draw for me? And if I think about how this field generally has evolved since 1978, when the first IVF baby was born, Louise Brown in Great Britain, we've gone from that first baby, now over 10 million IVF births in the world in less than 50 years. When you think about 40 years ago, we couldn't have a conversation about cryopreservation of embryos. 20 years ago, we couldn't have a conversation about the overwhelming successes we now see with oocyte cryopreservation. To me, it's this level of growth, development, and progress with our patients ultimately being the beneficiaries that makes this field so incredibly exciting. And for me, it's incredibly humbling. The potential for growth and change is research. Our professional society is really taking the lead, not just talking the talk, walking the walk in terms of how we fundraise and support research, because we realize that these are difficult times to get funding to do the type of groundbreaking research
Yeah.
that's going to push the field further. And so I've seeing that is incredibly hopeful, but I think we all feel things are still a little tenuous in that space, and we want to promote and support research breakthroughs and advocacy. And I think there are people out there who are doing that incredible work.
Thank you so much for taking the time to talk to me today.
Thank you,
It's
Jessica, for inviting me to this such an important program. And I'm honored to be a member of this distinguished group of current and emerging leaders and add my voice to them and hopefully be in dialogue with many more people who are interested in our, and I may be biased in this, but our outstanding field and subspecialty. Because one of the things we know is we need to grow our workforces, whether it's in the clinical sphere, whether it's in the embryology lab sphere, all manner of people are needed to deliver the care that our patients need in this country.